Great. Well, thank you everyone for joining. I'm Annika Izagari. I'm Communications Director with the Committee to Protect Healthcare. We appreciate you joining us today. As you know from our media release, over 15,000 physicians across the country have signed a letter calling on the U.S. Senate to reject Robert F. Kennedy Jr.'s appointment to be the Secretary of Health and Human Services. And in North Carolina, well over 400 physicians have signed this letter. 3 of those signing physicians have joined us today to share their concerns about Mr. Kennedy and to urge North Carolina Senator Tom Tillis to reject his appointment. I'd like to note that the full list of signatures is not being shared publicly with press due to privacy concerns for the other physicians. If you have more questions about that, please feel free to follow up with me after the call via email or phone. I'll make sure that those are in the chat, and I'm happy to discuss that more. Would also like to note that the physicians speaking today are speaking as individuals and with the Committee to Protect Healthcare and not necessarily on behalf of any employers. So we respectfully ask that you only refer to them in any coverage as they introduce themselves. Thank you in advance for respecting that. Without further ado, I will introduce our first speaker, Dr. Breen. Oh, Dr. Breen, you're on mute still.
Hi, I'm Dr. Samantha Breen. I'm a family physician in the Raleigh area. My fellow doctors and I are here today to raise our concerns about the nomination of Robert F. Kennedy Jr. for Secretary of Department of Health and Human Services. We are calling on the U.S. Senate to reject his nomination. Specifically, we're calling on our Senator Tom Tillis, who is a member of the Senate committee which recommends Mr. Kennedy for the vote to oppose his nomination. We're among well over 400 North Carolina physicians speaking out against Mr. Kennedy because of the threats he poses to the health of our nation. Across the nation, thousands of doctors have spoken up. Many of my colleagues and friends are deeply concerned about this nomination and have spoken to me about it in private conversations. There are more than 15,000 physicians nationwide who have signed a letter calling for the U.S. Senate, including Senator Tillis, to vote against RFK Jr. as HHS nominee. RFK Jr. has zero real experience in any area of the medical field, as he was an environmental lawyer. He is not only unqualified to become HHS secretary, he is an active threat to the health and well-being and safety of all Americans by peddling outlandish, unfounded, and dangerous health conspiracy theories. Should RFK Jr. be confirmed as HHS secretary, it would effectively drive our nation's health policy. He could undermine science as well as evidence-based medicine. He would corrode the relationship of trust patients have with their doctors. During the COVID-19 pandemic, it was often helpful to use trusted government sources like the FDA, for example, to ease patients' concerns regarding new treatments. This nomination delegitimizes the Department of Health and Human Services. We are professionals who dedicate our lives to studying and understanding evidence-based medicine. Doctors are deeply concerned that patients will refuse to accept medical recommendations based on misinformation that is coming from the highest levels of government. We should be focusing on increasing healthcare access and improving outcomes of our diverse North Carolina community, but Mr. Kennedy could take us back to times when diseases like polio ran rampant. Recently, North Carolina just saw our first case of measles in more than 6 years. A generation ago, this disease was virtually eradicated.
Did Dr. Breen cut off for others?
She did.
Okay, I think we'll move on then and have Dr. Spence speak. Dr. Spence?
Oh, hey. Hi, this is Dr. Frank Spence. I live in Elkin, where I practiced family medicine for years and then urgent care and pediatrics and now telemedicine. As Dr. Breen said, we're here because we believe that Robert F. Kennedy Jr. isn't just lacking in medical and managerial experience. We also believe he actually poses a serious threat to the health of our patients and our families and our communities. So it's imperative that the Senate, including our own North Carolina Senator Tom Tillis, take this threat seriously and reject his appointment. RFK is a leading anti-vaccine activist who has spent years spreading false claims about vaccine safety. For example, despite what he falsely asserts, vaccines do not cause autism, a lie that has been thoroughly debunked in study after study. The highly successful and effective COVID-19 vaccines are estimated to have saved more than 14 million lives in the first year of use, according to the National Institutes of Health, a fact at odds with RFK's false and baseless claim that COVID vaccines are, in his words, the deadliest vaccines around. During the COVID-19 pandemic, his anti-vaccine organization, Children's Health Defense, capitalized on misinformation and raised over $23 million in 2022 alone. And RFK said that should he be confirmed and take over Health and Human Services, he will give infectious diseases a break to focus on chronic conditions. Unfortunately, infectious diseases don't take breaks, not to mention the fact that many chronic diseases are caused or exacerbated by infectious diseases like HPV and cervical cancer, hepatitis virus and liver cancer, measles with various neurological disorders, whooping cough and lung disease, and on and on. And ironically, it's only by controlling infectious diseases that people now live long enough to have chronic illnesses. Of course, we should and will keep working to help reduce chronic conditions. That's the work that doctors like us are doing every single day. But we shouldn't do so by making ourselves even more vulnerable to infectious diseases. So that's why we must encourage immunizations and why we must continue to develop new vaccines and improve on the older ones, such as the relatively recent RSV vaccine for respiratory infections, improvements in the pneumonia vaccines, yearly tweaks on the flu vaccine, and as well as vaccines for COVID and other threats. Vaccination rates in the U.S. have already been dropping in recent years. In some areas, the rates are below the critical levels for herd immunity. That puts our most vulnerable citizens at risk. In fact, the U.S. has seen multiple measles outbreaks this year. 89% of the cases are in unvaccinated people, and whooping cough epidemic is the worst since 2012. If RFK becomes HHS secretary, we fear vaccination rates will plummet even further, leading to resurgence of preventable diseases like measles and polio. In fact, members of his team have already launched an offensive against polio vaccine, which was a dramatic medical breakthrough when it was introduced in the 1950s, and which has prevented an estimated 20 million cases of paralysis in children and has nearly eradicated the disease worldwide. Ask Representative Steve Cohen from Tennessee and Senator Mitch McConnell from Kentucky, both polio survivors, what they think about getting rid of the polio vaccine. Vaccines are the best first line of defense against preventable diseases like measles, pneumonia, flu, polio, and many others. And undermining the effectiveness of vaccines and the need for immunizations goes against the best interest of public health and personal safety and well-being. We need to be vaccinating more people, not fewer. Public health under Mr. Kennedy could take one step forward, but 10 steps back. We simply can't afford to have RFK in charge of our nation's health policy. This is a challenging time for any legislator of good conscience, but it's times like these that reveal the character of our leaders and of our nation. We call on Senator Tom Tillis and other senators to face the challenge, follow the science, and protect all our citizens, young and old, sick and well, present and future, and reject Mr. Kennedy's nomination to this critical position. I'd now like to invite my colleague, Dr. Rachel Brown, to speak.
Hi, I'm Dr. Rachel Brown. I'm a neonatologist in Asheville, North Carolina. Doctors are taking action to protect our patients and our profession, upholding the Hippocratic Oath we took to ensure no unnecessary harm comes to our patients. As doctors, we are especially concerned about RFK's dangerous disinformation about vaccines and his efforts to undermine immunizations. The simple fact is that vaccines are amazing scientific achievements that greatly reduce death and disease in North Carolina and around the world. Vaccines are incredibly safe. Before they can receive FDA licensing, vaccines are studied in larger populations than other drugs. Once licensed and put to use, multiple layers of safety surveillance continue as long as those vaccines are distributed. Every scientific authority recommends routine vaccination. This includes the American Academy of Pediatrics, the American Academy of Family Practitioners, the American College of Obstetricians and Gynecologists, the American Medical Association, and many others. Vaccines helped eliminate polio from most of the world and eradicated some of the worst scourges of the 20th century, such as smallpox. Smallpox is highly contagious and was one of the deadliest diseases known to humans with no known cure. It killed people as far back as 1350 BCE. Thanks to the smallpox vaccine and global immunization programs, we rarely hear or talk about smallpox. That's because it was officially eradicated in 1980. However, we must not let our guard down, especially against emerging diseases. As you know, there is mounting concern for bird flu as it devastates wildlife and livestock across the nation. Epidemiologists are on high alert for bird flu as a possible springboard for the next pandemic after mutations have sickened people in the United States and Canada. The first death from bird flu in the United States was just reported in January. RFK Jr. advocates the use of raw milk. This unpasteurized product puts people at risk for foodborne illness and may also put them at risk for bird flu. Meanwhile, diseases that can be prevented with vaccinations are becoming more prevalent. Measles and pertussis, or whooping cough, rates are rising, and in 2023, 200 children alone died of influenza. The risk of pertussis is particularly unnerving in my patient population. These infants cannot receive their first pertussis vaccine until 6 to 8 weeks of life. And while older children and adults infected with pertussis suffer from the 100-day cough, as we call it, newborns often present with simply apnea. This means they stop breathing. It is scary and often life-threatening for newborns that are affected with pertussis. Beyond general vaccine cynicism, RFK Jr. has spread falsehoods claiming COVID-19 was engineered to spare specific ethnic groups and promoting discredited and potentially dangerous COVID-19 treatments like hydroxychloroquine and ivermectin. Our nation's health leaders at all levels strive to achieve public trust by promoting science and evidence-based medicine so we can avert diseases and protect health. RFK Jr. is bad medicine for America's health, and the Senate must reject his nomination. Senator Tom Tillis must reject his nomination, and over 400 of our medical colleagues in North Carolina agree. Thank you.
Thank you, Dr. Brown. And Dr. Breen was able to reconnect. Dr. Breen, did you want to finish your remarks? You're just muted.
Did any of it come through?
Most of it came through till then.
Okay, because I'm still trying to open it. Do you know where I was in it?
I think you spoke last about the prevalence of measles again in the state.
Okay.
We could also start Q&A and come back to you when you're ready.
Let's come back because I'm still trying to I just can't. I can pretty much remember it, but
No problem.
All right. Sorry
Great.
about
So in
that.
the meantime, not a problem at all, Dr. Breen. Thank you. In the meantime, we will open it up for questions. If you have a question for one or any of the physicians, the best way is if you could please type your question either in the Q&A function or in the chat box. And then we can make sure that we kind of go through them in order as best we can. So allow a few moments for folks to be able to type those questions. In the meantime, I'm also going to put my email address and phone number in the chat, and that way if you have follow-up questions after or need a copy of the recording or anything like that, you can reach out to me after the call. There's a question about why is this call focusing on Tillis rather than both Tillis and Bud, and that's for anyone to answer.
As I understand, it's because he's on the committee to promote the nomination. And of course, we're concerned that Bud will vote against it as well if it goes to the Senate.
Yeah, it's because he's the one who's on the committee. But
yeah, and just specify he is on the Senate Finance Committee specifically. A question in the Q&A from Laura. President Trump has said he believes RFK Jr. Will not be that extreme and will be open-minded as secretary. Any response to that? And again, that's for whomever wishes to respond.
Forgive me for being a little bit cynical about what President Trump thinks about what Dwarf F. Kennedy Jr. will do, based upon past experience. That's not very reassuring.
Thank you for that question. A question from Michael, also in the Q&A. You said that 89% of the measles infections are in unvaccinated people, but can you talk too about the dangers to people who do get the vaccines? That's the first part of the question, so I'll allow folks to respond to that as well. Again, to repeat that, you said that 89% of the measles infections are in unvaccinated people. Can you talk as well about the dangers to people who do get the vaccines?
So vaccines are very safe. We do know that there are very small percentage of people who will have reactions to vaccines. Most of those include things like fever, pain at the site of injection, and things like that. We do know that their vaccine reactions or complications are followed very closely. There is a place where people put vaccine reactions. There's a government website where those are put, but we do know in general, vaccines are very incredibly safe, and the impact that they have is immense.
Thank you. And Michael followed up to specify, can you speak more as well to the dangers of people who do get vaccinated, but are maybe more at risk because of those 11% of people who are, because of the unvaccinated people. So I think speaking to kind of like the herd immunity aspect.
I'm not sure that I'm going to answer the question exactly, but we do know that, for example, with the influenza vaccine, when we have people that are admitted to the hospital and have significant illness related to the influenza virus, those people have incredibly harder time with recovery and have an increased risk of death from influenza if they have not been vaccinated. So most admissions to the hospital and most deaths related to influenza are among children, at least that's my area of expertise, are among children who were not vaccinated. As far as herd immunity goes, herd immunity only works if there's a critical amount of people who are vaccinated. And the reason that people who are healthy get the vaccines are because there are others who cannot. For example, infants cannot be fully vaccinated until they're 6 months old, people who have different types of cancers, and even some people who have had vaccines and become immunocompromised, the vaccine does not work the same way in them anymore. So certainly herd immunity is to protect yourself, but also to protect others who are not able to receive those vaccines or receive the benefit from them.
And then the more people, just to add on to that, the more people that like don't get vaccinated, it like breaks herd immunity. So then the vaccine does not take in like every single person. And you need, like, if more people get vaccinated, that doesn't really matter because there's so much that the disease cannot like spread throughout the population. So that's why like having the higher vaccination rates is important for the polio and those kind of diseases. If that was what you were asking.
Yeah, I think that spoke to the question, hopefully, Michael. If not, please feel free to ask a follow-up question. And Michael had also asked, what will the medical community need to do if Kennedy is confirmed as secretary? That's for anyone.
So I think and what I think is going to happen is it's just going to be like so much more patient education and then like fighting a battle against like what should be like a trusted source that's not using evidence-based practices. So like it shouldn't be that big of a deal that someone's like spreading something, but it's not. You're just gonna have to counter it, but it looks like it's coming from a legitimate source, if that makes sense.
I also think that if the nomination is confirmed, that we will also need to remind ourselves how to identify people with diseases that we have not seen in a long time and how to treat those people and care for people with that. Because I do think that we will start to see things that we haven't seen in a very long time.
Yeah, it's going to be a real challenge to fight that. It's going to be, so much more of previously preventable illnesses to take care of. And like you say, most of us haven't even, I've been around a long time, and most of those diseases were controlled long ago. And so it's going to put a lot of people at serious risk, and we're just going to have to really push back. And, like Dr. Breen said, also fighting against what's supposed to be a reliable resource that's supposed to be doing most of the the information for prevention, et cetera, is just going to be such a terrible challenge that, we're going to have our work cut out for us.
Thank you all, and thanks for that question. Another question in the Q&A for anyone who wishes to answer. How do you balance herd immunity with individual rights?
Just like I'm sorry.
Sorry,
I was just saying, just like anything else, individual rights sort of end when you start creating problems for other people. And especially when you're talking about you're placing people at risk for serious illness and death. We have all kinds of laws that put limitations on individual rights, but for protection of the population as a whole, and there's no difference with vaccines.
yeah. To build on that, it's no different than the government says you have to wear a motorcycle helmet or a like seatbelt in the car, and no one's mandating anyone gets a vaccine. It's just, unfortunately, if someone is confirmed and they are spreading just outright non-science, it legitimizes that science. So we're not saying you can't say that on the internet. It's that this being in a high level of government legitimizes claims that are not proven by the scientific method.
Thank you all. We'll allow another minute just in case there are any follow-up questions. Again, I also put my email address and my phone number in the chat for, I didn't put that for everyone to see, so let me make sure that everyone is able to see that. So if you need a copy of the recording or anything like that after the call, please feel free to send me an email and I can get that to you. Sorry, one second. And I'm not seeing any other questions, so we'll go ahead and wrap up. I really want to thank everyone for joining today to hear from these 3 physicians among more than 400 across North Carolina who are concerned about the prospect of Kennedy being appointed as HHS Secretary. And thank you so much to our physician speakers, Dr. Breen, Dr. Brown, and Dr. Spence. We appreciate your time and your advocacy on behalf of your patients and all Americans. Thank you again. All right, have a good afternoon, everyone. Thanks.